الله الرحمن الرحيم. الصوت واضح؟ الصوت واضح شباب؟
تمام أستاذ.
نعم دكتور.
بسم الله الرحمن الرحيم. وعلى بركة الله نبدأ محاضرتنا الدراسية العليا هذا اليوم 2 شهر السادس 2021. محاضرتنا لهذا اليوم هي تكملة إلى اللابوراتوري انفستيجيشن اللي بدأنا به بالمحاضرة السابقة. الحقيقة بالمحاضرة السابقة ركزنا على الهيماتولوجيكال investigation and what are the investigation which are required for the dentist. وتكلمنا عن complete blood picture، وتكلمنا على differential cell count، وتكلمنا when we are going to use this laboratory investigation، واخذنا بالتفصيل الوايت بي سي evaluation والار بي سي evaluation، وتكلمنا ايضا عن العفو، وتكلمنا ايضا على البليتلت evaluation also. وقلنا المطلوب من عندنا we are going to know the differential cell count of the RBC of the white BC whether neutropenia، مثلا الاسباب مال النيوتروبينيا والاسباب مال النيوتروفيليا. تكلمنا ايضا عن الليمفوسايت well, what are the most common causes of the lymphocytopenia, what are the most causes of the lymphocytosis. For example, we gave about the viral infection, Epstein virus, TB, toxoplasmosis. Again, we have more information regarding the monocyte type of cell. وقلنا انه low count it is not considered to be as a medically significant بالنسبة لنا. وعددنا الأسباب اللي associated with an increase in the level of the monocyte. Furthermore, we have another information regarding the eosinophil and regarding the basophil. وتكلمنا عن الهيماتوكرايت and the different terminology which is going to be facing during conducting our laboratory investigation, like for example the mean corpuscular volume, the mean corpuscular hemoglobin, the MCHC. كل هذه تكلمنا عليها when it is going to be increased and what are the factors which is going to be influence of the decrease. Furthermore تكلمنا عن البليتلت اللي تعتبر بالنسبة لنا جدا مهمة. تكلمنا when the platelet count is going to be decreased، وإن هذا الترمينولوجي يدعى بالثرومبوسايتوبينيا. عددنا الكثير من الأسباب التي تؤدي إلى الثرومبوسايتوبينيا اللي منها اللوكيميا، الليمفوما، and furthermore we have an idea about the myelodysplastic or sometimes even chemotherapy or radiotherapy. وأيضا تكلمنا عن المين platelet value when this is going to be increased in every size of the platelet, when it is going to be decreased. Furthermore, we have more idea regarding the iron deficiency anemia and what are the causes of the iron deficiency anemia and how we make a diagnosis, what is the laboratory changes, and we concluded that those types of patients may have hypochromic microcytic type of anemia. Furthermore, we have more idea regarding the pernicious anemia. وقلنا الcauses مع the pernicious anemia, like for example, lack of the intrinsic factors, which is responsible about observation of adequate amount of vitamin B12. Furthermore, we know that the small intestine do not have the ability to observe adequate amount of vitamin B12. In addition, there are certain disease and certain medicine which is going to lead to pernicious anemia. تكلمنا أيضا على البلاستيك anemia. وقلنا الكوزز مال البلاستيك anemia sometimes it could be acquired disease, like for example from the patient have been exposed to the toxin, arsenic, benzene, and even though if the patient exposed to the radiation and to the chemotherapy, وقلنا another causes it could be inherited disorder. تكلمنا عن أيضا some of the syndromes which may associated for that. أيضا من ضمن الأمور اللي تكلمنا عليها اللي هي الهيموليتيك أنيميا. وقلنا أكو أيضا inherited hemolytic anemia like for example the thalassemia, the skill cell anemia, and also the hereditary spherocytosis. In addition, glucosylphosphate deficiency اللي أيضا تكلمنا عليه وعلى الانزيمز which is responsible about that. Furthermore, we have an idea about the acquired hemolytic anemia. وتكلمنا sometimes it may occur due to drug-induced hemolytic anemia, or even though in something which is called mechanical hemolytic anemia, even certain infection is going to be led to hemolytic anemia. تكلمنا ايضا بالمحاضرات الثلاثيميا وقسمناها الى major thalassemia وقسمناها الى minor thalassemia. وقلنا البيشنت ابو الماينر thalassemia he do not have any sign or symptoms. وقلنا البيشنت with a severe form of beta thalassemia يدعى بالثلاسيميا major or police anemia, and here it is going to be affected both male and female, and severe form is usually diagnosed early. هذه هي أهم الأمور اللي تكلمنا عليها فيما يخص
دكتور
الثلاثيميا.
العفو، ممكن بس الصوت شوية
العفو دكتور، الصوت مو واضح.
الصوت شوية مو واضح.
الصوت مو واضح؟
اي والله
اي والله
دكتور، الصوت مو واضح.
عفوا دكتور، بس يعني ضعيف، هو مو قضية ما واضح وإنما بعيد جدا، يعني ناصي ده يطلع لنا.
اوكي. سألينا أكثر شيء. الآن شلونه؟
اي نعم دكتور، أحسن شوية هسه.
شوية هسه علينا إلى أكثر شيء يعني، وأنا همين راح أعلي صوتي شوية. And also we have some idea regarding the signs and symptoms of thalassemia. تكلمنا there will be lack of oxygen in the bloodstream, and people who may have alpha thalassemia or beta thalassemia usually have mild anemia. هذه أهم الهيماتولوجيكال investigation ومراجعة مختصرة اللي تكلمنا عليها. So أيضا we have idea about the skill cell anemia which is considered to be as inherited, and here it is considered to be as a lifelong disease. People may have inherit 2 copies of the skill cell gene, one from each parent. بعد أن خلصنا هذه أيضا تكلمنا على the bleeding time، تكلمنا عن the clotting time, and also about the activated partial thromboplastin time, which is considered to be very important during investigation. Furthermore, we have some idea about the ESR. وقلنا ESR, it is not considered to be as specific because sometimes it may associate it with infections, sometimes may associate it with autoimmune disease, like for example rheumatoid arthritis, rheumatic fevers, vascular disease, whatever. And even though sometimes ESR can be less than normal, and this may give me indication about the polycythemia, skill cell anemia, and the leukocytosis also. بعد أن خلصنا هذه أيضا انتقلنا إلى ال INR. قلنا هو ال INR هو International Normalized Ratio, which is going to be referred to the PT, where it is considered to be as a standard and we are going to use this type of test, especially if the patient is taking warfarin, and if the patient have impaired in the liver function test, also we recommended for him to make the INR, and also patient with a pulmonary emboli. هذه أغلب التستات اللي تكلمنا عليها بالمحاضرة السابقة. هنا واضح، هذا تم المراجعة مالتنا. أيضا راح نتكلم today. We are going to focus and we are going to emphasize on the following. هذا خلص لحد الآن مراجعة سريعة ما أخذناه بالمحاضرة السابقة فيما يخص اللابوراتوري انفستيجيشن. أما بالنسبة لليوم فراح يكون تركيزنا عما يلي. First of all راح يكون تركيزنا، راح ناخذ معلومات على البايوبسي، على الفاين نيدل اسبريشن، على الكور نيدل بايوبسي، على frozen section أيضا in addition to the immunofluorescent test. طبعا البايوبسي كلنا نعرفه and everybody have made the surgical operation. What types of the biopsy اللي هي incisional, fine needle aspiration, core needle biopsy, exfoliative cytology also, and we need sometimes a frozen section and even though oral brush. In biopsy, the wild thickness of the epithelial cell is going to be needed for histopathological examination. And we know the indication, any ulcerative lesion, any white, any area which does not respond to the treatment, which persists for more than 2 weeks, which is increased in size, and associated with a necrotic tissue. All of the above conditions need to be biopsy for histopathological examination. Sometimes the wild tissue is going to be removed for histopathology, and this is what we call it the excisional. Sometimes only small piece of tissue of the lesion is going to be used, and here we're going to use it as a preliminary examination, and this is what we call it the incisional biopsy. Even though sometimes we are going to use a cytology, and here the exfoliative epithelial cell is going to be needed for the examination. And again, we have an idea about the fine needle aspiration, which is considered a cytology test. Sometimes we consider it as a biopsy. And here we are going to use a long thin needle inserted in the suspicious area. And we are going to see if there is any dysplastic changes, any changes in the cells of the cell. Either small size of the needle is going to be used into the vital structure. Another type of biopsy اللي ممكن يتم استخدامه اللي هو core needle biopsy. بمثل هكذا حالة, a larger needle with a cutting tip is going to be used, and we are going to draw a column of tissue from the suspicious area. The sample are large.
دكتور الصورة ثابتة ما تتغير.
ما يخالف هذا الكلام هسه بعدين راح نغيره ماكو مشكلة.
تمام.
على الكور نيدل بايوبسي وأيضا الإكسفيلوتيف cytology, and here there will be examination from the cells, scraping from the tissue. And we are going to detect if there is any acantholytic types, any plastic. And another way, وهذا العفو كله تكملة للمحاضرة السابقة راح أنزل لكم إياه. The frozen section also, during the surgical operation, we could detect if there is any dysplastic changes into the tissue. And this is usually taking within 10 minutes after taking the specimen. And the tissue is going to be sent to the lab. Then after that is going to be freeze to about -70 degrees by liquid nitrogen or even by dry ice. And here the main advantage of the frozen section is to establish a diagnosis during the operation. يعني أثناء ما الجراح يسوي العملية ممكن أن تأخذ piece مال tissue تذهب for a frozen section, and we could determine whether this types of lesion is considered to be benign and malignant. And according to that, the surgical operation was going to be taken into consideration. Sometimes freezing artifact is going to be occur, which is going to be affected the cellular picture. التست الأخير اللي immunofluorescent test اللي هو direct immunofluorescent وindirect يستخدم هناك for the acantholysis بالنسبة لجماعة البامفيكاس. طبعا البامفيكاس بالجالس والبلس بامفيكاس وتعرفون الفرق بيناتهم. Another way for the examination اللي هو الimaging طبعا واللي هو CT scan, الMRI والروتين OPG هذه ممكن أيضا تطلعون عليها. Even though sometimes in the laboratory investigation we need to make culture and sensitivity tests to know the most common types of microorganisms which are associated with the infection. Even though cultivation of the Candida albicans is very important. هذه تكملة إلى المحاضرة السابقة والتست which are going to be used. So today we are going to have more idea regarding the test of the liver, the test of diabetic, the test of the thyroid, and some of the immunological tests which are required. بالحقيقة, the test which is used for the diagnosis of the diabetic is usually depend mostly on the age and depend mostly on the sign or symptoms of the patient. That is to say, we have two types of diabetic, mainly type 1, which is mostly occur in children and young patients, and type 2, which is usually occur in an old patient above 40, above 50. And here we could demonstrating in type 2 that patient is more obese and may have a risk factor to develop the diabetic. Even the type of the test of the diabetic is usually depend firstly on the present of the clinical symptoms, اللي هي polyuria, polydipsia, polyphagia. In addition, the age of the patient, whether the patient is young or children, for example, or an old patient who have a risk factor to develop a diabetic. Another type of diabetic, gestational diabetic, and this type of diabetic is going to be occur at the pregnancy, mostly occur between this time, between the 24 to 28 weeks of the pregnancy. This is what we call the gestational type of diabetic. And here, all the pregnant women who do not have a diabetic diagnosis before should be tested for gestational diabetic. And here it should be done, especially at this period of time, 24 to 28 weeks. Sometimes this gestational diabetic is going to be disappear after the pregnancy, or sometimes it is going to be continue with the lady even after the delivery. فالفقرة الأولى, how we are going to diagnose the diabetic and the pre-diabetic. What I mean by pre-diabetic, till now the patient have been not diagnosed as a diabetic, but may have a clinical symptoms that I have mentioned before. Here we are going to use the fasting plasma glucose, fasting blood sugar, and it is going to be measured the blood glucose level at a single point in a time, and mostly occur in the morning. And here we are going to advise the patient to be fasting at least 8 hours. And we have to put in our mind, when we are going to put the patient for fasting, he could swim or he could drink water, and this does not affect the fasting status of the patient. إذن الفاستنج يستخدم بالنسبة للبيشنت who till now we have not been diagnosed but may have clinical symptoms of diabetic. مثل ما قلنا هنا, in the morning, and even the patient should not be eat anything but water, it does not affect the results. الهيموجلوبين A1C اللي تعطي الافريج ليفل مال البلاد جلوكوز over the past 3 months. Other name تدعى بالهيموجلوبين A1C, glycated hemoglobin, glycylated hemoglobin. هذا كلش very important. And here the patient could not be kept under fasting. And here the patient is already diagnosed as a diabetic, and we want to know, or we want to evaluating the type of a treatment which is going to be given to this types of patient. When our patient he is already diagnosed as a diabetic, he's already on treatment on diabetic, whatever this type of a treatment. But actually, we want to evaluating the type of a treatment to the patient. There are many factors which is going to be influence this type of test. That is to say, if the patient is anemic, or even the patient with impaired in the renal function test, or the patient with iron deficiency anemia, all of these is going to be affected the result of the hemoglobin A1C. So it is used to manage the diabetic of the patient. يعني suspect that the patient attending to us and he is taking, for example, insulin, whatever, خابط أو صافي، وأعتقد احنا شارحين الفرق بين الخابط والصافي والانترميديت من حيث الريت مال الابزوربشن مالته، من حيث التايم that which are required in order to apply the dental treatment, when the maximum effect of the insulin is going to be occurred. في مثل هكذا حالة عندما يأتينا البيشنت he is already on treatment, we do not prescribing for him a fasting blood sugar. هنا طبيب الأسنان يعطي إلى الشخص أو يعني يرسل الشخص is sent for laboratory investigation for the hemoglobin once he taken into consideration that the patient do not have some of the factors which is going to be influence the results, like iron deficiency anemia, impaired in the liver function test, and so on. Another type of test which is required in upper random, and here we do not wait until the patient is going to be fasting. We want to take the level of the plasma glucose at once. Therefore, we are going to send the patient for random glucose test. Regarding the diagnosis of gestational diabetic, how well the body is going to be handle the glucose during the pregnancies. Another type of test, glucose challenging test. Pregnant is checking for gestational diabetic. In the glucose challenge test, another name for this test is the glucose screening test. And here we are going to draw blood 1 hour after drink a sweet liquid اللي يحتوي على glucose. And here we do not need to fasting for this type of test. If the result is between 140 and above, we are going to need to return to the oral glucose tolerance test while fasting. The oral glucose tolerance test, how we are going to make this type of test? We are going to measure the blood glucose after fasting for 8 hours. Then the blood is going to draw, will drink the liquid containing glucose. And here we are going to use the diagnosis of the gestational diabetic every 2 to 3 hours. في حالة الهاي بلاد جلوكوز ليفل بتحليلين أو 3 ورا ساعة ورا ساعتين وثلاثة يبقى مرتفع. This may give me idea that the patient may have a gestational diabetic. While if it's going to be decreased, يعني بالتحليل الأول عالي، التحليل الثاني عالي، التحليل الثالث يكون قليل, this may give us that patient do not have gestational diabetic. Sometimes we need another type of test in order to confirm that. في الحقيقة أعيد بصورة مختصرة بالأورال glucose tolerance test. Here we are going to measure the blood glucose after the patient is fast for 8 hours. Then after that we are giving him a liquid containing a glucose. We are going to drawing the blood every 2 to 3 hours. عندما يكون high blood glucose level any of 2 or more blood tests during the oral meal that the patient may have a gestational diabetic. While if it's going to be decreased the level with tested valid, this means that the patient will not have a gestational diabetic. To confirm the diabetic is type 1, here we are going to use several types of autoantibody. In type 2, this antibody does not represent. If a diabetic occurs when the patient is pregnant, here we have to get tested 6 إلى 12 week after the baby is born to see if the patient have type 2 diabetic or not. هذا الكلام اللي تكلمنا عليه انه after delivery we have to check the diabetic of the pregnant woman whether it is continue to be diabetic or not. Another type of tests which are recommended for us. العفو بالنسبة بليز احنا بالنسبة للدايجنوزيس يعني مال الهيموجلوبين A1C اللي هو يتراوح من 5.7 ويوصل يعني للسبعة والثمانية واكو قسم من البيشنت. يعني بالنسبة لنا كأطباء أسنان أرجو أن تنتبه الأرقام وفي يعني مهمة بالنسبة لنا. يعني خلينا نقول 5.7 5.8 it is considered to be as normal below that. ولكن من يسعد ويلحد يوصل لمدة 6.5 أو 6.6 is considered as a pre-diabetic. لكن بالنسبة لنا الهيموجلوبين A1C إذا ازداد عن 6.6 6.5 فوق we consider this patient is a diabetic. The same will apply بالنسبة للفاستنج. يعني الطبيعي مالته 100 وجوه pre-diabetic نعتبره من 100 إلى 120. الآن قسم من الدراسات تقول لغاية ال 125 it is considered to be as a normal or pre-diabetic. While if we get the result above 125, so we could consider this patient 130, 140, we consider this patient is a diabetic. While for the oral glucose tolerance test, يعني below 140 it is considered to be normal. عادة من ال 140 ل 200 we consider as a pre-diabetic. Above the 200 يعتبر دايبيتيك سواء كان oral glucose tolerance test وإذا كان randomly أخذ. Above 200 we consider it as a diabetic. Again الدراسات الحالية تقول we could not consider that the patient is controlled diabetic or not. يعني ما بشيء اسمه control لأنه control at once we do not know after that how the diabetic status of this patient is going to be again. إذن هذا هي أهم tests which are required for the diabetic. ألخصها بصورة مختصرة: fasting blood glucose, gestational diabetic, random plasma glucose, with glucose challenge test, oral glucose tolerance test. بالنسبة للأورال glucose هنا تعطى كمية من الجلوكوز liquid or drink to the patient ونأخذ بكميات معينة and العفو تؤخذ بأوقات معينة and we are going to indicating the patient whether he is diabetic or not. هذا فيما يخص التست of the diabetic. Another type of tests which are required هو test of the thyroid. تكلمنا بالمحاضرة السابقة على test of the thyroid. How we are going to examine the clinical. وقلنا بالنسبة إن الثايرويد تكون على شكل butterfly shaped gland in front of the neck. وقلنا الآدم apples يعني which is located يعني thyroid lies below the Adam apples and in front of the windpipe. The thyroid بصورة عامة تحتوي على two loops connecting to each other by the isthmus. إذا هناك tests which are used for the examination of the thyroid, the test of the thyroid اللي هي 3 نقاط رئيسية. الميجر thyroid hormone هو الثايروكسين which is called the T4, and it is called like that because it is contained 4 iodine atom. The T4 يتحول إلى T3, and this is usually occurred by the remove an iodine atoms. And you have an idea that the amount of T4 produced by the thyroid glands is controlled by another hormone اللي هو البيتيوتري gland located at the base of the brain, ويدعى thyroid stimulating hormone. إذا المبدأ الرئيسي هو الهايبوثالاموس تأثر على البيتيوتري. اوكي، البيتيوتري جلاند تعطي الثايرويد ستيميوليتنج هرمون والذي يؤدي على الثايرويد. هذا هو النيجاتيف فيدباك اللي control the secretion of the thyroid gland. خلينا ناخذ فكرة عن الثايرويد تيست. اخوان اكو 3 نقاط رئيسية اللي هي البيشنت يكون نورمال او يكون البيشنت هايبرثايروديزم او يكون البيشنت هايبرثايروديزم برايمري او هايبرثايروديزم سكندري. خلينا نعرف what are the changes which is going to be occur in each condition. في حالة النورمال كونديشن TSH و T4 يعتبر نورمال. في حالة الهايبرثايروديزم TSH يقل لأن أكو هناك نيجاتيف فيدباك، يقول لي ما أحتاج لأن T4 عندي عالي بقلل TSH مالتك. أما في حالة الهايبرثايروديزم تقسم إلى قسمين رئيسيين. القسم الرئيسي الأول هي البرايمري هايبو والسكندري هايبو. أرجو أنه تنتبهوا وياي. في حالة السكندري هايبوثايروديزم التي اس اتش والتي 4 اثنيناتهم يعتبرون لو. في حالة البرايمري هايبوثايروديزم يعني بعد بالبداية الخمول يكون موجود، يبقى التي اس اتش عالي لأن يعطي إيعاز أنه هناك التي 4 قليل، يبقى التي اس اتش عالي. لكن في حالة الهايبوثايروديزم اللي هي سكندري تي اس اتش والتي 4 كلها سوف تقل. إذا البيست واي هاي مقدمة على التست مال الثايرويد مالتها كلينيكالي. ناخذ معلومات عن الثايرويد. المبدأ الرئيسي انه عندي هايبرثايروديزم وعندي هايبوثايروديزم. الهايبوثايروديزم يقسم الى برايمري وسكندري. متى ما كان سكندري كل التي اس اتش والتي 4 راح تقل. متى ما كان البرايمري يبقى التي اس اتش عندي عالي، يبقى يعطي ايعاز. اذا هنا الاوبوزيت سيتويشن التي اس اتش مالتي لما يقل. ليش يقل؟ لانه التي 4 مالتي يزداد. هذا شيء نسميه يصبح الاوفر رياكتيف، وهنا يصبح بالهايبرثايروديزم. متى ما الهايبرثايروديزم is going to be increased more than that يصبح الثايروتوكسيكوسيس. إذا لدي الكثير من المصطلحات بالتعامل في هذا الموضوع. المصطلح الأول اللي هو الجويتر، المصطلح الثاني اللي هو الهايبرثايروديزم، المصطلح الثالث اللي هو الثايروتوكسيكوسيس. والهايبوثايروديزم ينقسم إلى برايمري وينقسم إلى سكندري. ناخذ فكرة عن التي 4 تيست اللي طبعا جدا مهم. التي 4 circulate in the blood in two form. قسم من عنده bind to the protein، وهذا يمنع التي 4 from entering the virus tissue تنسني thyroid hormone. والقسم الآخر باعث فيه T تي 4 وباع التي 4 اللي يكون باوند للبروتين، باع الديفرنس بالاكشن مالته. التي 4 الفري the most important to determine the thyroid function ويدعى بالفري تي 4. الفري تي 4 index. Individuals who have a hyperthyroidism will have evaluating for the free T4. لكن البيشنت اللي عنده hyperthyroidism يبقى عنده low level مال T4 or the free T4. And it, as a general talking, may give me indication about the thyroid gland function. أعيد بصورة مختصرة، أرجو أن تنتبه ورايا. شوية هذا الموضوع يراد له حفظ، شوية يراد له تركيز، لكن أعرف أنه أكو هايبوثالاموس. هذه الهايبوثالاموس تأثر على البيتيوتري، البيتيوتري تعطي الثايرويد ستيميوليتنج هرمون وتعطي هرمونات أخرى. هذا كله يعتمد على النيجاتيف فيدباك اللي يكون موجود. عندي 4 حالات رئيسية: حالة النورمال، حالة الهايبرثايروديزم، وحالة الهايبوثايروديزم التي تنقسم إلى برايمري وتنقسم إلى سكندري. في حالة السكندري أصبح كل شيء تي 4 وتي اس اتش الآن اثنيناتهم لن يكون لديهم سكريشن، سوف يصبح لديهم لون سكريشن. ولكن في حالة الهايبو ولكن بعدها برايمري يبقى الإيعاز يعطى عن طريق الهايبوثالاموس تو ذا بيتيوتري، أي يبقى التي اس اتش عالي عندي. ليش؟ لأن التي 4 عندي قليل. أما في حالة الهايبرثايروديزم هناك إيعاز يعطى إلى التي اس اتش، لدي كمية كافية من التي 4، الرجاء تقليل كمية التي اس اتش. نأخذ an idea about the T3 test. It is mostly used for the diagnosis of the hyperthyroidism or determine the severity of the hyperthyroidism. And hyperthyroidism have evaluated bil T3 level عندما يزداد يصبح لديه low TSH. إذا هو feedback mechanism. أي هرمون سوف يزداد بالبلاد مال الشخص سوف يعطى فيدباك كافي ترسل لي هذا الهرمون. TSH راح يقل عندما T3 يزداد. انتبه هنا. Only the T3 is evaluated and the free T4 is normal. T3 testing really helpful in hyperthyroidism. إذا بالهايبوثايروديزم يتم الاعتماد أكثر شيء على التي 4 مثل ما ذكرنا. متى ما تم تشخيص الشخص، أرجو أن تنتبه ما عليه، متى ما تم تشخيص الشخص سواء كان هو هايبوثايروديزم أو severely hypothyroidism ولكن لديه high TSH low free T4، هنا في هذه الحالة we could demonstrating that it may occur during pregnancy or even after the patient is going to be taking contraceptive pills. لأنه مثل ما نعرف there will be hormonal changes and the estrogen is going to be increased. And as a result of that, increase the level of the binding protein. متى ما تم تشخيص الشخص انه هو لديه مشكله بالثايرويد سواء كانت T3 او T4 او TSH, what is the next way to confirm that? The next way to see whether this effect or this disturbance in the hormone is related to the autoimmune disease or not. يعني هنا يقوم أبو اللابراتوري يفحص الثايروغلوبولين والثايرويد بيروكسيداز. إذا here we are going to detect a positive anti-thyroid peroxidase or an anti-thyroglobulin antibody in a patient with hyperthyroidism in order to confirm whether the patient may have a gravus, may have a Hashimotosis. هذا الكلام اللي تكلمنا عليه. Okay. لاحظ هذا contraceptive pill is going to be affected the result. بعد أن تم التشخيص أن هناك مشكلة بالثايرويد، أن هناك مشكلة بالsecretions of the hormone, we are going to detect whether the antibody is thyroid peroxidase thyroglobulin antibody. هنا نستخدم هذه التستين في الحالة الثنائية in order to confirm if the patient has an autoimmune disease or not. Another type of test اللي تلعب radioactive iodine. Use of the iodine, scan changes here, excessive reproduction. هنا يمكننا أن نعرف إذا كانت الغدة خاملة أو لا عن طريق الراديوactive iodine. Radioactive iodine, here we are going to measure the amount of radioactivity that is usually taken by the thyroid gland. هنا تعطيني idea whether the gland is going to be functioning normally. A very high radioactive iodine is going to be occur in a patient with overreactive, patient with a hyperthyroidism. And sometimes the radioactive iodine is usually not going to be taken by the thyroid gland. And here we could demonstrating that the patient may have a hypothyroidism. هذا radioactive iodine عندما يحقن إلى داخل الثيرويد gland كيف سوف تتخلص منه الغدة الدرقية. Whether the gland is going to be functioning normally, this may give me indication that the high radioactive iodine is going to be seen in an individual with a thyroid overreactive. After finish the test of the thyroid أعيد T3 T4 TSH وزيادتها وقتها حسب النورمال، حسب الهايبرثايروديزم، حسب الهايبوثايروديزم سواء كانت primary أم secondary. أيضا the most important things to take into consideration فيما يخص الثايرويد هي thyroglobulin antibody in addition to the radioactive iodine. Test of the liver, SGOT والSGPT، ALT، ALP هو الالكلاين فوسفاتيز. بالنسبة لل ALT which is help break down protein found mainly in the liver اللي هو SGPT. ALP, this may give me indication in alkaline phosphatase that the patient may have a damage in the liver, sometimes may occur due to the block of the bile duct, whatever the cause of the block. It could be sometimes due to stone, or sometimes due to cancer, which is going to be affecting overgrowth, or even though any lesions or any bony lesions which is going to be affecting the bone. Here we could demonstrating the evaluating the level of the alkaline phosphatase. طبعا التوتال بروتين اللي هو الالبومين والجلوبولين low level can be damage or a disease. In AST أيضا another types of enzyme which is going to be found into the liver. And then these are the most common types of the test of the liver. The bilirubin, when the blood cell is going to be break down and the liver cleans bilirubin out of the body, and the condition is going to be considered to be a jaundice. This may give me indication about the liver damage. The glutamate transferase test, high level would be point to the liver damage or even the bile duct damage. Lactic dehydrogenase is going to be increased in a PT patient, or sometimes it may give me indication about the medication which is called thinning of the blood, like for example the warfarin. إذا أعيد بصورة مختصرة test of the liver. test of the liver تنقسم إلى نقطتين رئيسية. test of the enzymes like for example the ALT, وهذا الانزيم break down to protein mainly found inside the liver and may give me indication that the patient may have a damage to the liver. الانزيم الآخر اللي هو الالكالين phosphatase أيضا may give me indication about the liver damage and may give me indication whether the lesion or the sarcoma is going to be affected into the bone. with total serum protein وهي الألبومين globally, the AST, bilirubin test. Again, the lactic dehydrogenase and the PT test. Another test which is considered to be very important for us as a dentist, test for the hepatitis. So, which type of patient we need to make a test of hepatitis? Any patient who is work at the care health worker, موظفين الصحة, the dentist. Also the patient if he is going to make hemodialysis, whatever, يعني patient with a kidney failure, hemodialysis, whether either peritoneums or IV shunt, and patient who have previously been exposed to any injecting illegal drugs, patient with a continued blood transfusion or organic transplant, even though patient who have previously exposed to any sexual intercourse or have been exposed to the patient with hepatitis C virus. Type 1 hepatitis مثل ما نعرفه type 1 type B والآن وصلوا C و D وصلوا more than 28 types of hepatitis. But as a general topic, let's have some idea regarding A اللي هو العلاقة بالفود not علاقة بالsexual or blood contact. Hepatitis A virus الخاصية مالته it is going to be start as a flu-like illness. When our patient يأتي من a flu-like illness, that is to say cough and runny nose, change in the speech. بينما hepatitis B virus اللي هو له علاقة بالبلاد أو له علاقة بالsexual contact, sometimes it is going to be persisting as asymptomatic for a long period of time, and even though it could be diagnosed accidentally for the patient, and as a complication it may lead to the liver cirrhosis. طبعا يعني خلينا نقول 10% or 20% is going to be changed into liver cirrhosis, or even though in a rare case, especially for hepatitis C, sometimes it's going to be changed into hepatocellular or مختصر hepatocellular carcinoma. فإذا لدي 3 types of hepatitis. الهيباتيتس سي يعني هو طبعا التهاب الكبد الوبائي، واللي اكثر واحد اللي ممكن يؤدي الى hepatocellular carcinoma even though it may cause what we call it يعني هوجكن، يعني سرطان الكبد او الاورام اللمفاويه ايضا. طبعا الكونتاكت مالته from infected person to another through the blood. And sometimes we are the dentists, we are responsible about to transport it through sharing needles or other equipment. هنا نسأل في السؤال which one is more worse, hepatitis B or hepatitis C? يعني هذا نترككم انتم تجاوبون عليه. واكو هناك difference diagnosis between them. أنا بالنسبة لي أركز على hepatitis C because it is considered to be as infectious and occurred by the hepatitis C virus, and it is mostly going to be affected the liver. and أهم clinical symptoms مالته أيضا fever وداركيوريا abdominal pain، يعني يبدأ ب GIT disturbance. Here we could demonstrating that the patient may have a yellow-tinting skins. Any needle stick, any blood transfusion may lead to transport of hepatitis C. Hepatitis D يعتبر defective virus can replicate only in the process of hepatitis B. يعني هو co-infection with hepatitis B, or sometimes it is considered to be a superimposed infection, and it is going to increase the severity of hepatitis B. هذه المصطلحات التي تورد لدينا أثناء الفحوصات الكبد الفيروسية. ال IgM indicated cell infection. Here, total antibody indicated that the patient IgM antibody يعني IgH in the absence of the IgM indicated that the patient may develop immunity, previously had been infected with this hepatitis. When we are going to have any patient who is complaining of hepatitis, we have to know whether the patient he is now infected. So we are going to send him for hepatitis C antigen. We could indicate that the patient now may have the infection and is considered to be as infectious to us. While the antibody indicated that the patient had previously been infected with this type of hepatitis. The IgM mean presently. The antibody indicated that resolving the infection, sometimes even due to therapy or anything else. لاحظ, currently infection, we could detect the DNA of these types of virus. Antibody means that the patient previously had been infected. Or D will be considered to be as co-infection or super-infection. The same when applied for this terminology. The IgM sometimes may give me indication of the hepatitis D, indicated that there is a co-infection or super-infection within the hepatitis B. C, the presence of of antibody of hepatitis C, which is going to give me an indication. It may give me the indication, the presence of hepatitis indicated to me that the patient have previously resolved an infection, or even though false positive antibody screening test. The RNA of hepatitis C indicated that the patient currently been infected. طبعا we are going to have some idea about the mode of transmission بالنسبة للهepatitis. The most important things مثل ما قلنا اللي هي hemodialysis or transfusion, therefore or sexual contact or drug use or organic transplantation. Even though some of the study indicated that the tattoo is may associated with that. السؤال اللي نطرحه انه sometimes the pregnancy, that is to say mother to child transmission of hepatitis C, occur in a small percentage. Anyhow, breastfeeding is not considered to be as the way of transmission of hepatitis C. الدايجنوزس مالتنا بصورة عامة we could detect the antibody and we are going to detect it the liver enzyme level. Another type of test which is required for us اللي هي الكدني تيست. هنا ممكن أن نستخدم اليوريا واللي تعتبر على شكل waste product or creatinine which is considered to be as a waste product made by the muscles going to be passed into the bloodstream. And the most important things هي glomerulus filtration rate بالنسبة للكدني. And here the glomerulus filtration rate is considered to be more accurate to us, and normal value مالته من 90 إلى 120 مل بالمنت. Even though we could detect the presence of the salt in the kidney, and we are going to have some idea about sodium, potassium, chloride, and bicarbonate. أعتقد كملنا الفحوصات المختبرية اللي ممكن ناخذها. هذه كل الفحوصات المختبرية خلينا ناخذ فد زبدة عليها إنه أكو sensitivity وأكو specificity بالنسبة لها. Sensitivity إيش قد أكو true positive correctly identified. Specifically the proportion of true negative إيش قد. And هذه مصطلحين كلش مهمة when we are going to study the sensitivity and the specificity of any type of test. هذا بصورة عامة يعتمد كل الفحوصات المختبرية على السامبل. The way of the collecting of the sample, the way of the transfer of the sample to the laboratory, the way of the mixing. Sometimes we need anticoagulant and so on. The temperature in which the sample is going to be preserved. And even though all of the laboratory tests that I have mentioned before, it may be associated with an error. Sometimes this error may occur during ordering the test. That is to say, يعني الإيرور قسم من حاجة متعلقة بي يعني كطبيب. I do not know which type of test I have to send the patient. ينوضح هذا مثلا patient عنده الآن sign or symptoms of hepatitis. So I have to send the patient for hepatitis surface antigen to determine whether the patient is now having the infection and he could transmit the infection to me. Or the patient, for example, he is diabetic and he is under treatment. Therefore, I have to send the patient for hemoglobin A1C to demonstrating whether he is controlled or not. Other of the error may relate to the reporting, or even though interpreting of the result is very important. هذه قسم من المصطلحات اللي ممكن تواجهها أثناء histopathological examination اللي هي تعطيني indication about the types of the lesion that I'm going to be sent. So مثلا enlarge of the nuclei, keratinization of the single cells, drop shape of the retinopathy. كل واحدة من هذه المصطلحات لابد يعني إذا ممكن أيضا تطلعون عليها لأنه ممكن بنتائج التقارير مال الهيستوباثولوجي خصوصا جماعة السيرجري when they are going to receive that ratio of the nuclei to the cytoplasm, the hyperchromatin, and كل واحدة تعطيني indication regarding the dysplastic whether it was mild or moderate or severe. هذا في حالة المايلد ديسبليجيا. حالة المودريت ديسبليجيا هذا كله له علاقة بالبايوبسي. وفي حالة السيفير ديسبليجيا لما يجيك هذا المصطلح or when you are going to receive that this type of lesion is considered to be as a mild dysplasia. Here we could demonstrating that the agriculture is going to be disturbance into the middle third of the epithelium. And here the degree of the cytological atypia may require upgrading into severe dysplasia. Severe dysplasia من يجيك أيضا what is going to be given in mind, and sometimes it is going to be changed into carcinoma in situ. Here the full thickness of the epithelial agricultural disturbance in the cell wire is going to be affected. إذا ثلاث مصطلحات رئيسية ممكن تجيك: المايلد والمودريت والسيفير. أرجوك طلع دراسات عليا تنتبهون إلى هذه المصطلحات and which one is going to concern you more than others. أعتقد لهنا خلصنا الساعة الثانية من المحاضرة وخلصنا laboratory investigation. If there is any question, please do not hesitate. إذا أكو أي سؤال فيما يخص المحاضرة laboratory investigation please رجاء لا تفعل سواء كان بالقسم أو باقي الأقسام. رابط الحضور العفو سجلتوه؟